Hello, today we're going to be going over the manual lymphatic drainage of the upper extremity. So for this video today, we're going to be doing the left arm, but just know that you can do it on the left or the right arm. So to start off with, you're going to start with taking 10 deep belly breaths, filling up your stomach, your lower abdomen with air, and then as they breathe out, doing a little spiral in, and before they breathe in, doing a quick push in. So this is priming some of the lymphatic vessels. Breath in, and then spiraling down. So 10 of these deep belly breaths. You're going to try to do an M shape with your hand as you're going to different points. And then after you've done those 10 times, you can get into the rest of the sequence. So we're going to start with the deep lymphatics, stimulating those first, and this is a more moderate pressure. So the first thing is going to be muscle bending at the bicep. So you're going to go back and forth like this. If you have an extra person doing it with you, you can use your leg or something as a prop. And then you can use both hands and bend the muscle like this. If it's just yourself, you can use one hand. So you're going to go back and forth, bending the muscle for 3 to 5 seconds, 5 times, and you're going to find a couple different points on the muscle to do this. Like I said, this is a little bit of more moderate pressure, stimulating the deeper lymphatics. Okay, so after you finish working on the front of the arm, you're going to come to the back of the arm and do the triceps. Again, you can do it like this if you have someone helping you. If it's just you yourself, you can go back and forth with one hand. And again, 3 to 5 seconds at each point that you're working on 5 times. You want to do at least 2 different areas along the muscle. And then with these, sometimes you can notice a little bit of skin redness, which is normal since your skin is being rubbed on a lot. Okay, so the next one you're going to do the forearm, the outside of the forearm and the inside. So starting with the outside, doing your muscle bending. Again, 3 to 5 seconds at each point, doing it 5 times. And then while doing lymphatic drainage, it's better to have your nails cut, trimmed, and hands clean to prevent risk of infection if you were to accidentally cut yourself with your nails. And then the last muscle bending we'll do is on the front of the forearm here. Same thing, 3 to 5 seconds at each point, 5 times. And then this one is not on your sheet, but if you wanted to add it, after you do the triceps or the back of the arm, you can do down here and work on the back of the armpit or the lats here. Again, 3 to 5 seconds at each segment, 5 times. And again, this would be after the tricep or back of the arm sequence, but before the forearm. You don't have to do this one, it's just if you want to add this one in, you can. Okay, and then going down to the hand, you're going to do presses between the bones in the hand. Hold for a couple seconds and then go down, and this will be repeated 5 times. And then from the front of the hand, it'll look like this, between the bones in the soft spot of the hands. Again, with some moderate pressure, priming the deeper lymph nodes. And then the next one in the hand will be the thumb presses, so pressing at the base of the thumb and kind of opening the hand a little bit. 5-second holds 5 times. Okay, so those are all the deep lymphatics. So next you're going to come back to the shoulder. You want to start closer to the trunk before moving down to clear any swollen areas. So you're going to start at the shoulder, you're going to move across and then up slowly. This is going to use very light pressure, just enough to move the skin. So you should see the skin move and then the skin rebound after you let go. Again, very light pressure. You want to do the scooping motion across and then up like this, and this will be done 7 to 10 times. You can do it upwards of 20 times if you have a little more swelling in a particular area. Okay, and then you're going to move down, starting at the elbow, going up to the shoulder. So you can do, we will do inside and outside of the arm. Again, across and then up, almost like you're making the letter J, going all the way up into the shoulder. So that was 1, so we have 6 more of these. This takes a little bit of time, but try to take your time and not rush through it. And the whole time while you're doing this, make sure you're taking deep breaths, those deep belly breaths. Again, very light touch, going across and up into that J shape. And then now you may need to reposition a little bit, keeping the arm elevated. And now you're going to do the inside, going up from the elbow to the arm. Again, across and up, the J shape, very light pressure, going up into the armpit. Okay, moving from there, you're gonna go to the elbow and do little circles, scooping up. Make a little C right above the elbow bones 7 times, very light, small hold at the end, and then letting the skin rebound. And then you'll do the other side as well. So with all of these different manual techniques and with the stroking of the lymphatic vessels, you want to try to get it to go up and towards the armpit. Okay, and then you're gonna go from the wrist to the elbow next. So this one you can either put a pillow or your leg to help keep the arm elevated, and the same thing going across and up towards the armpit. Stopping at the elbow, going back down to the wrist. Very light touch across and up. Again, 7 to 10 times. More times if you need to, if there's more swelling in the area. And then next you'll go the front of the lower arm, wrist, going up to elbow. 7 to 10 times. Again, that light touch going across and up in that J shape. And then you can do some of the skin stretching at the hand. 7 to 10 times, light touch, light pressure, just enough to move the skin. And then once you've worked all the way down the arm, now you're going to go back up. So again, you're going to go wrist to elbow, 7 to 10 times. More if you have more swelling. And then he'll go down the front. Again, very light pressure. Doing your J scoop across and up, wrist to elbow. 7 times to 10 times. And this you can either do it on yourself, or if you have someone to help you, they can help you as well. So next, you're gonna go elbow to shoulder, the same across and up, light pressure, 7 to 10 times, more if more swelling in the area. Trying to keep the arm slightly elevated while you do it. And then the same thing on the other side. You're gonna go inside of the upper arm, elbow to shoulder. Going all the way into the armpit, 7 to 10 times. And then you're gonna go into just doing the shoulder again, all the way up. More the shoulder joint into the clavicle. 7 to 10 times. And then the last thing we're going to do is the deep belly breaths again. So taking a deep breath in and then spiraling down as they exhale, and then push down right before they inhale slightly. And then doing your points in an M shape. And after you've done 10 of those deep belly breaths at the end, then you have finished the upper extremity or upper arm manual lymphatic drainage. Thank you.